Hey guys, welcome back to the O&D Life. And once again, I have been on a hiatus for about a month, it seems like. I, you know, I think I gave you guys an update a little while back that I had vestibular neuritis, dizziness, vertigo. Had a video where I talked a lot about that. In a prior life, I was a vestibular rehab specialist. And so that was really right in my wheelhouse. And, um, you know, you know how it is that, especially you married guys, you guys know how your wives will, we'll say nag for lack of a better word. They will keep on you to keep getting checked out, and you can't possibly self-diagnose, even if you're pretty versed in the area. So, needless to say, I believe in my update I talked about going to my primary care doctor, and I think I did the video just shortly after that visit. Where he pretty much concurred. Looked like I had an inner ear infection or a vestibular neuritis. Also had an infection in my outer ear. Had some ear drops for that and a oral antibiotic for that as well. The inner ear, the vestibular neuritis, usually is viral, and so an antibiotic isn't really effective for that. Your body kind of fights it off, but it sometimes does some damage. It kind of short circuits that nerve, is what I like to say. And then your brain has to adapt to that short circuit. It kind of rewires itself in how it interprets that information in that ear. So, anyways, that doctor concurred. I was getting better, which was the natural course of vestibular neuritis. Your body's adapting and it's getting better, and I need to push myself to provoke some of the dizziness, balance problems, and you build it back up, basically. When I had gone to my PCP, he had listened to my lungs and just said, have you had a COVID test? Let's do one. So we did it. That was on a Tuesday. Needed to wait until Thursday to get the results, is what he said. I never got a call back on Thursday or Friday. On Monday morning, I thought, I'm kind of curious what the result was. Gave him a call, and turns out it was positive. So I was positive for COVID. Potentially, I say asymptomatic. I did not have any of the traditional, traditional in the sense of a cough and a fever. I don't think I ever had a fever. Never. I felt kind of fatigued overall. I have been feeling fatigued. Thought that was more just age and all that good stuff. But anyway, I had some GI symptoms, perhaps. I had some headaches, but a lot of that is not unusual for my normal everyday way of life. Eating out, having a bad diet, sitting in front of a computer doing documentation, getting sore neck and radiating some pain up and around. So I've kind of battled that for a long time. So I didn't feel like that was a big difference. I had to be quarantined, if you will. But again, hey, that's my lifestyle. That's my preference, actually. But during that time, I was actually working from home. I was able to work from home, but just needed to be quarantined away for the allotted time and make sure I don't give it to any patients or coworkers, basically. So that was that. It's kind of interesting. Your mind starts to like get the better of you. It was, the initial diagnosis, like, wow, dang. And then naturally, I'm very worried about my wife who has some health problems, and didn't want her getting it. She's definitely at risk. Um, she did not get tested. The assumption is that she has it, being in the same household. Same with my daughter. However, fortunately, none of us had, any real ill effects. You could say we were asymptomatic, which is kind of scary again, because being out there, before I got the test, I was, going about my business. I wear a mask. I know it doesn't save you, obviously, but what it does do is if you have it, you're not blowing out the virus in the same way, spreading it. So, I do believe in that. And it does decrease the amount of virus that you're spewing out, and potentially taking in. It doesn't prevent it from getting through the mask, but it decreases the amount, and so the amount that you're exposed to is at a much lower level, and I credit that to why I had such a mild case. So that being said, I got through that. I was still like I said, the normal course of my inner ear problem had to build up my balance again. My wife still noticed that I was unsteady, especially coming in from outside. My wife keeps things kind of dark. And so naturally, one of my three senses that I use for balance, visual input, inner ear, and feeling the ground. When I'd come in, my eyes would have to adjust, and it would be, basically it's like dark. And my balance would be off. And so she could always notice that. And so she's not satisfied with my diagnosis, and therefore, wanted me to go see an ENT. Now, I was kind of curious, hey, let's go ahead and get it checked out. I have a small cyst in front of my ear here that, there was some talk about it growing in and causing some problems in years past, but it has remained superficial, and so it's not a problem. But I always thought, what? Hey, it wouldn't be bad to get it checked out. My wife thinks that my hearing, I can't hear, and really I can. Her voice seems to be right at that tone that I can't hear. Strange how that happens. I think it's like, being around the machinery, you're going to lose your hearing if that constant, same noise. I think that's what's happened. Again, I digress. Trying to be funny, but not really. It's true. So she wants me to go see an ear, nose, throat doctor. And so I did and got my hearing test. He concurs with the vestibular neuritis, but did a hearing test, did some pressure tests on my eardrum and stuff. And I had a slight hearing loss in my left ear, enough that he said, well, we could justify doing an MRI. And, since there was that slight unilateral loss on the one side. And again, I thought, it wouldn't be a bad thing really to get it ruled out. I have headaches all the time. So I was and I thought, you know what, they might get my upper neck. Hey, might show some arthritis in there, and just, hey, let's get that area checked out, is what I thought. So we did get that done, got it ordered, got it scheduled October 1st, so that, that was the beginning of my new, I guess you'd say, fiscal year for my insurance, so that everything goes to my deductible. You guys know how that crap works, I'm sure. But went to go get that, and that was in the morning. Went ahead and came home. I was going to go ahead and work from home that day. And it wasn't long before I got a call. I missed the phone call, but I, got it shortly after. But it was quite a surprise. I'm going to play the message here. Maybe.
Hey, Garrett, this is Dr. Simpson. I just got a call from the radiologist a few minutes ago. He did your scan review, and there is a finding. It's not really what we were looking for, though. It's more or less an incidental finding, but there's actually looks like there's some type of growth in the pituitary gland region, and there may be some active issues from that. For instance, it may have some evidence that it may have bled at some point, and that is certainly very concerning. Most of those, of course, are not cancers. They're going to be a benign tumor. But because of its location, it creates some risks to your vision. If that was to grow, it might put pressure on your optic nerves. It is already right up against them as it is. So I'm trying to get in touch with you. If you actually are having some eye symptoms or worsening symptoms with your vision, like loss of visual fields or anything like that, I'm not sure I'd even wait. I'd go ahead and try to go to the emergency room to get the fastest input by neurosurgery. But if you really haven't had much change other than the fact that you've had some balance that's improving, your vision seems fine, then we could certainly talk about it. But I'm not even sure I'd want to wait. I'm not sure I'd want you to have to come into the office and spend that extra time waiting to look at a film with me when I know that we're going to then have to get a neurosurgery opinion. The only question is whether we get that opinion urgently or not. So please call back. I'm actually in Coleman today, but if you just call the office at St. Vincent's, then they can let me know you've called back and I can call you. So just call 205-933-9236 and tell them that Dr. Simpson wanted you to call me so I can get back and talk to you today so we can decide whether you need to just see a neurosurgeon quickly or whether you actually need to go to the emergency room. That has to do with whether you're having any visual symptoms with this. But definitely this needs to be addressed, and it's not an ENT issue. Primarily, it's really a neurosurgery decision. All right, sorry to give you that information, but it is urgent enough to go ahead and leave that message for you so you know it's important. Thanks a lot. Bye.
Okay, so that was, what was that, October 1st, and so that kind of rocked my world just a little bit. And my wife, my daughter, you hear that and you think the worst naturally. Gave him a call back, and he did say that normally these are benign, so not cancerous, so that's good. But sometimes they can bleed and or have circulation cut off to them, and then they swell and can cause pressure on the optic nerve and cause some blindness. Your peripheral vision starts to close in, double vision, diplopia is what they call that, and some visual problems. And I will say, since my inner ear problem, my vision and I broke my glasses that day before, and things have been just a little bit off, and so this might have something to do with that. Okay, so if the blood supply gets cut off or it bleeds into itself and it swells up, it can cause pressure onto the optic nerve, onto other structures in that area, and it's an emergency surgery to go in and get it removed and relieve that pressure. So I called the doctor back right away and, confirmed that I don't have any visual, field decrease. And so he called a neurosurgeon and was going to get me in as soon as possible, the next day. So I think October 1st was a Thursday, was going to try and get me in, the next day. The doctor, the neurosurgeon that he called, ended up referring me on to Dr. Riley, who is at the Pituitary Clinic at UAB Medicine, University, Alabama, Birmingham. They have a medical school there, and they have a pituitary tumor clinic where they have the neurosurgeon and an endocrinologist that will see you in the same visit, same day, basically, normally. The endocrinologist wasn't, so they got me an appointment for the following Tuesday. So that was last week. Yes. Went in and just, Dr. Riley, first off, if you have a problem with your pituitary and you're in the area, within 4 or 5 hours, I'd say even, Dr. Riley and Dr. Vaughn over at UAB, the Pituitary Clinic, is where you want to be. The explanation that she was able to give me, kind of delineate out when you would be a surgical candidate, when you wouldn't be, what types respond well to medicine, why they're taking all this blood and checking it and checking my hormone levels, is going to be able to tell them a lot, whether or not it'll respond to medication or not. And any other hormone replacement. The pituitary kind of is the master gland, as they say, to tell other adrenal glands what to produce, how much. And so it can really throw off the hormones and cause you problems. So I got all the blood work done. They gave me a call. So they wouldn't have that back until the next day. I went in on a Tuesday. Wednesday, I didn't hear from them, but I did hear from them Thursday morning, first thing, and with an apology that they did not call me the day before. But I couldn't be happier with them, really. So they gave me the results of the blood test and what that means and what they're going to be calling in for prescriptions. So the type of pituitary tumor that I have is one of the more common types that is benign. So again, there is that. And it responds well to medication. So that's good. However, because of its size, so it's a tumor, I think off the top of my head, 2.5 centimeters up and down by 2 centimeters by 1.8. So, kind of the other dimensions there. But height was 2.5, width 2, depth 1.8. So kind of give you an idea. But I mean, so that, inch by little under an inch by a little under an inch. So, what was I going to say? So not a candidate. Because of its size, it is probably limiting the function of the pituitary and not telling it to produce other hormones and the other glands to produce other hormones. And so I'm on some replacement hormones for that. In addition, it seems to be secreting a particular other hormone. So I'm on a medication to help decrease that level, and that helps shrink the tumor, that same medication. So I'll be doing a follow-up in a month to check the hormone levels and get that checked out, and then another follow-up for an MRI and doctor's visit in 6 months to see if indeed it is shrinking. So that's probably the better scenario. However, I've learned a lot about hormones and something called adrenal insufficiency, and that you can go into an adrenal crisis where, if your body's not making cortisol, that's the stress hormone, to respond to stress. Too much can be a problem, but not enough can be a problem as well. And your blood pressure can end up dropping, and you can cause, you don't have enough blood pressure getting to your organs, and obviously that can be a problem. So there's discussion about a medical alert bracelet, an emergency injection if you were in an accident and you started to go into an adrenal, insufficiency crisis, they call it. And also your body, you need to supplement in times of great stress, injury, sickness, to fight off, those instances. You might need to supplement a little bit more even. So I'm kind of learning about that. Supposed to have a medic alert bracelet that would, if I was incapacitated and couldn't share that information, that they would know as well. So I'm learning a lot, but hopefully in a couple years it will be shrunk enough that I can get off of one of those medications and just have to be monitored, yearly or every couple years, something like that is my understanding. So that's kind of where I'm at. And so I just started the medication this week, and I can already tell a difference. So, that explains a lot of my fatigue. I thought I was just getting old, and, the headaches and stuff. I thought I was just getting old and falling apart, basically. But it looks like it was because of that pituitary tumor and the hormone imbalances. So, hey, might even lose a little weight, they say, and I used to joke. I shouldn't say this. I don't think it's PC, but, I think I heard someone say, "Oh, I'm not fat. I just have a glandular problem." So I can honestly say that. So anyway, I'm rambling. This is kind of a long video. I intended it to be short, but I haven't been focused on videos. Doing a little bit of stuff in the yard, with the equipment, but not a whole lot. This is, after getting COVID, kind of taking it easy, getting this scare, took it easy. But I'm feeling better. And so I hope to get going with some other videos. I think, I'm going to be doing some trimming of trees. So that means chipping. I'm going to be moving some muck out of the horse area. So there'll be some action of that, perhaps. I've done multiple videos with that, but we'll see. I might include it. Let me know if there's anything in particular that you guys would like to see. I do have some footage of the DR trimmer, 3-point trimmer. I could probably put together a video discussing it a little bit. You guys let me know. Let me know if there's any other equipment. I think in my mind this fall and winter, I think I might try and pull out the post hole digger, punch a couple holes in the ground. I might put a gate across my driveway. Let's see here. I'm going to try and clear some, I say it, golly, every single fall and winter that I want to clear some land, some underbrush. Um, that'll be in the works, perhaps. Uh, there's lots of other honeydew projects that I need to do, and so we'll just take it as they come. Hopefully, I'll be feeling good and being really productive. Get you guys some good videos. I think I might also do a little bit of a review of my go-to lounge around the house pants. I think I am going to do it because I carry a decent amount of stuff in my pockets, even when I'm at home, laying around, running out to the store. But I finally found a pair of pants that will accommodate it all. Seems to be holding up better than other pairs that I've purchased off of Amazon. And yeah, I'm just happy with them. So I might do a review of them for a little bit of content, and you guys might get some value out of it. Included with that might turn into a little bit of an EDC, everyday carry video related to it, because talking about everything that I carry in my pockets and why I like these pants so much. Just to give you an idea of what they are, it's the Duluth Trading Company dry on the fly. I can't remember the name, so you have to wait for the video. But they're lightweight, they dry quickly. I'll have to get more information, obviously, before I do a review. I do have a pair of their carpenter's pants, fire hose, which I like also, that I put on when I'm doing more work around the place outside. I can, and I do like those as well. I have no problem with them. The pockets are sufficient. There's some other features that I like. They have some stretch to them, which apparently I'm really bad about. I don't know why, but I always rip out my pants, it seems like, in the crotch or, in that area. For whatever reason, but these seem to be holding up well against that. So I think I might do a video on that. You guys let me know if you're interested. I think that's it. Hey, if you guys have stuck around for the end of this, thank you. Good grief. I can't believe it's almost been 30 minutes. So anyways, you guys, once again, I'm just thankful for all of the viewers, subscribers, the community. I've been enjoying a lot of the videos. John Ritterbit will do, Mike Morgan, and more Outdoors with the Morgans. Kind of seems like we, watch you guys grow and, just. I don't know. It's funny how you kind of feel like you're friends, and not family, but friends. My YouTube friends, Kurt, over with Coyote Kurt, and Don with Houndsman One. Hope you're doing better, buddy. I don't want to air out your business, but I just he had some events and is having to heal up, so I hope you're doing well, Don. John over there at Louisiana Aquaponics, recovering from the hurricane, couple of them, so hope he's doing well. So just thankful for a lot of the YouTube family. Bill Bennett. I'm going to forget someone. Always it seems like you were always in on the live stream. So thank you. And I know I'm forgetting someone, a channel, but just thank you. I appreciate it, and hope to be bringing some more content, and looking forward to feeling better and all that good stuff. So anyways, O&D out.